Morning, doctor.
A helpful place to stand, Mark, is it? Just in case it wasn't obvious. Okay, are we ready to go?
Yes.
Okay, I'm able to tell you quite a lot more than I have been able to before, because Malala is now well enough that she's agreed that she's happy, in fact keen for us to share quite a lot of clinical detail with you. So I think I can probably be a little more helpful than I have been in the last couple of conferences. What I can tell you is that Malala is still showing some signs of infection, which is probably related to the bullet track, some infection in the bullet track, which is our key source of concern. So to repeat my phrase from Tuesday, it's clear that she's not out of the woods yet. Having said that, she is doing very well. In fact, she was standing with some help for the first time this morning when I went in to see her. She's communicating very freely. She's writing. She has a tracheostomy tube in because her airway was swollen by the passing of the bullet. So in order to protect her airway, she had a tracheostomy tube in. So she's not able to talk, although we have no reason to believe that she wouldn't be able to talk once this tube is out, which it may be in the next few days. In terms of her injury, she was struck around here, just above the back of the left eye, and the bullet went down through the side of her jaw, damaging the skull, the jaw joint on the left-hand side, went through the neck and lodged in the tissues above the scapula, the shoulder blade on the left. The bullet was removed in Pakistan fairly straight, pretty much straight after the event. In terms of her further care, the specialist teams looking after her are taking a view that she is going to need a couple of weeks to rehabilitate, make sure this infection is cleared up, and again, to use the same phrase, that she is out of the woods. Then her skull will need reconstructing, either by reinserting the piece of bone that was removed initially, or with a titanium plate. And her jawbone, her jaw joint may need further work down the line, but that remains to be assessed in a couple of weeks' time. Happy to take any questions.
Rupert Even from ITV News. The fact that you're giving us more detail now, you implied that has come from Malala. She has said yes, it's okay, has she, or she's intimated it's okay?
Yes, I didn't speak to her myself, but I was there this morning when one of my colleagues spoke to her, one of my colleagues who speaks Urdu, just to make sure we were communicating well, although she is understanding English as well, it would appear. And she's keen that people would share the details. She's also keen that I thank people for their support and their interest, because she's obviously aware of the amount of interest and support this has generated around the world, and she's keen to thank people for that.
Any infection is obviously concerning.
It is.
Can you give us an idea on the depth of concern?
It's always difficult to quantify. These things either just gently settle down of their own accord, or become a major problem. And I'm not able to predict that. I mean, I certainly would be over-optimistic to say that there's not going to be any further problems. But it is possible she'll make a smooth recovery. It's impossible to tell, I'm afraid.
We've had a few days of assessments, Charlie Dagnus. Yes. You've had a few days of assessments now. What can you tell us about neurological damage or hope optimism?
We know there was some damage to the brain. We believe from the MRI scans we've done here that the bullet grazed, if you like, the lateral part of the brain up here. We know that most of the damage is actually caused by shock waves from bullet injuries like this. They cause a lot more damage than you would get if you simply poked a needle through tissue. So there is certainly physical damage to the brain. That's for certain. At this stage, we're not seeing any deficit in terms of function. She seems to be able to understand. She has some memory. I'm led to believe. I've not spoken to her in detail myself. Like I say, she's able to stand. She's got motor control, so she's able to write. Whether there's any subtle intellectual or memory deficits down the line is too early to say.
She has memory of what happened. She's aware of what's going on.
So I understand, yes.
So it means there is no need of any surgery, sir?
So sorry, just one at a time. No, the communication, we're trying very hard to keep it just to normal doctor, nurse, patient communication about her sort of needs at the moment. We don't, it's too early to really start going into that. And we know that from a lot of the work we've done with our military casualties, we know that reminding people of traumatic events in this stage increases the potential for psychological problems later, so we wouldn't do that.
Sorry, has she had any communication now with her family? Has she going to speak to them?
No, she hasn't, as far as I'm aware.
So they need that communication perhaps?
I think we are trying to arrange for her to listen to her father on the phone. She's obviously not able to speak on the phone because of the tracheostomy tube in. But as I've said before, the family arrangements are being dealt with by the High Commissioner rather than the hospital direct.
What was it she actually came out of the coma?
Yeah, it was what we would call a medically induced coma. It's essentially an anaesthetic. It's a long-term anaesthetic, just pretty much the same as you'd have for an operation. And you know, people emerge from that slowly over 24, 48 hours. So you know, the sort of dramatic awakenings you see on drama programs don't really happen in real life. So people just gradually get more and more awake over 24, 48 hours.
How long now has she been aware of this?
It was Tuesday afternoon. She was one of the first things she asked the nurses is which country was she in.
Does she understand what's happened to her and why?
I believe so, yes. There's every sign that she has some recollection of it. As I say, we've not pushed it we wouldn't do that. It would be wrong to do that. But there's every sign that she understands why she's here. And I mean, you know, it's a very difficult position for her clearly because you know she's gone from being on her school bus and then the next thing she'll be consciously aware of is being in a strange hospital in a different country. So she seems to have understood why she is no longer in Pakistan and what's been happening to her.
Has her family seen her yet? Or
No.
They haven't, so
No,
not met
they've not come over.
So
Sorry,
is
you were
there any
trying to
need
ask
of
me.
any further surgery or she is in good senses?
Not at the moment. There's no plan to do anything probably for another couple of weeks, and then she'll need the skull reconstructed. And I guess that's something I would say on the back of that question is there's unlikely to be any sort of major news really for a couple of weeks. It's going to be a process of recuperation and recovery. Obviously, we would let you know if there are any dramatic changes in her condition. But if things go well, then there shouldn't be dramatic changes in her condition. It should be a gradual recovery of strength.
You said previously that she wasn't out of the woods. Yes. How are you said previously she wasn't out of the woods. How are you feeling now? Is she nearer being out of the woods or not? What would you say?
Yeah, she's closer to the edge of the woods, but she's not out of the woods. Yes, that's not pushing a metaphor too strongly.
This infection, is there a risk it could spread, or do you think
Yes.
you've got it under control?
Well, we hope we've got it under control, but I can't tell you there's no risk of it spreading. I mean, obviously, the tissues around the neck and tissues around the brain are not somewhere it's ideal to have an infection. And it's being treated, it's being assessed on a pretty much hourly basis. So we would hope we're on top of it, but there are no guarantees for people who are as sick as she has been. Yeah,
Has she inquired about the two others who are injured with her?
I don't know. I don't know.
What can you share in terms of her experience?
Well, to say she, I guess go back to what I said a while ago. The fact that she's asking me to, on her behalf, thank people for their support probably tells you as much as we can about how strong she is, really.
Has she been made aware of the world watching her?
Yes. Yeah.
Do you expect her family to visit anytime soon?
I said the Pakistani High Commissioner dealing with the family, so I can't answer that.
Is she able to watch television and see what's going on?
She would be able to. I'm not sure whether she has, to be honest, but there are TVs in the cubicles, yeah.
Have there been any other sort of security alerts like there was a couple of days ago?
No, there's been no more incidents now.
Do you have any indication as to when her family might be?
I don't, sorry, no, as I say, it's all being dealt with by the High Commission.
Dr. Rossa, I know you said the bullet went back of the eye. Is that the eyesight affected?
No, it was around here, the skull above and then down through the side.
Is there anything particularly unusual about that bullet here? Is it what you'd expect? Is it different?
I mean, I guess and it's very difficult to no two bullet injuries are the same. I mean, it would appear that she was shot from above. Is really all I can say. But no, there's nothing dramatically. It's a relatively low velocity bullet. injury.
Are you able to give a timescale? Are we still talking about months in terms of
I think we're talking a number of weeks before we would embark on any reconstructive surgery that's necessary, and a good, probably 6-8 weeks after that before she's well enough to think about leaving a hospital. That's a guess. All these things are guesses, I'm afraid.
Does she give any emotion away? Is she smiling? Is she crying? Is she, I don't know.
I've not spent very long with her. She's obviously being looked after by specialist ITU and paediatric nurses, and I haven't gone into that. It's not. I'm not directly caring for her, so other than reassuring myself she was happy for me to share this information with you, I've kept away from her. Really, she's got enough pressures on her without me hovering.
Does she still have the potential for a full recovery?
She's got the potential for pretty much a full recovery, yes.
How many different specialties are actually looking at her? If you can give us a number.
I think we've had about 8 specialties so far, something like that.
Immediate and in the long term. Or is
We'll deal with things as they come up. I mean, we've got specialist microbiologists helping us with the infection, specialist radiologists, 2 or 3 different radiologists, because she's had lots of different imaging modalities, surgeons of various different types, anaesthetic and intensive care doctors. There's all sorts of people are needed.
Doctor, just to underline, first thing you'll want to do is to clear up the infection.
Yes.
After that, a few days, a couple of weeks before you start reconstructive surgery.
The surgeons are talking a couple of weeks.
Do you have a sense from the injuries of how fortunate Malala was to survive and how close she actually came to being killed in the incident?
Well, very, I think, is the answer to that. I mean, the bullet is, as I say, the bullet grazed the edge of her brain. I guess certainly if you're talking a couple of inches more central, that probably is almost certainly an unsurvivable injury. So you would be talking inches, certainly, yeah. Okay. Thank you.
Thank you.